This legislation is absolutely, totally filled with pork. It is driven by special interests. And it is, the whole Senate bill got through as a patchwork. It's almost like a Christmas tree of special interests to get 60 votes out of the Senate. And for the president to say that he shut special interests out when everybody was coming to the White House trying to cut their deal, everybody wanted a seat around the table, the labor unions meeting until midnight to try to cut their own special deal. It's absolutely appalling that the president says that they did this in an open process, that they did this by cutting out special interests because they did nothing but keep the doors closed with special interest representatives inside the White House to cut this deal. Every independent analysis of this legislation shows that it is going to increase costs for the American people, it is going to increase federal spending, and it is going to increase the deficit. Only by cooking the books and by using a bunch of budget gimmicks to try to get around the Congressional Budget Office process did they even begin to pretend that this legislation would reduce the deficit. A month after it was signed into law, the chief actuary of Medicare issued a report that should have been issued before the legislation was passed because it showed that this will increase federal spending by $310 billion by 2019. And it will, the chairman of the Senate Finance Committee, Senator Baucus, actually in a slip during a floor statement acknowledged that, oh yes, well the bill doesn't really cost a trillion dollars, it costs $2.5 trillion. Seniors also are in the sights of this legislation. Even under the most conservative estimates, this legislation is going to cost $1 trillion. $575 billion of the spending is going to come through through cuts in Medicare services, either cuts in payments to doctors and hospitals or cuts to the Medicare Advantage program, the very popular program that allows seniors to choose from among competing private plans. So to think that they're going to strengthen Medicare by taking $575 billion out of this program to create a new entitlement program for younger Americans, it's a very disingenuous statement to tell seniors that Medicare is going to be stronger as a result. It absolutely is going to lead to rationing of health care, as the president has basically acknowledged in his own selection of his Medicare advisor, who is basically saying, I love rationing, we just need to have it be transparent and done by government. I am not a constitutional scholar, but the constitutional scholars with whom I have spoken say that they don't see anything in the Constitution that allows the federal government to require individuals, citizens of this country, to spend their own private money, their personal funds, on purchasing a private product. And that's basically what this legislation does. And it says you're going to be fined on your taxes if you do not purchase health insurance from a private company. And now the administration is turning around and saying, oh, well, we're not really, it's actually a tax, because they do have taxing authority. But the tax is a penalty for not purchasing it. It is not what the federal government is requiring you to do. They're not saying you have to pay tax. They're saying you have to buy private insurance. So I think these challenges, and that's actually only one of a number of challenges of this legislation. Absolutely. There are many other constitutional challenges to Obamacare. The states' rights issue, for example, the 10th Amendment. Governor Mitch Daniels of Indiana was in Washington last week talking about this legislation, and says that he believes that this encroaches on states' power and authority to basically be the primary sources of governing the American people, and that this treats the states like contractors to the federal government. And they're pushing back. We've already seen 20 states pushing back and saying they don't want to be contractors to the federal government to run the high-risk pools. So they're saying, it's your program, you come in and do it. So I think you're going to start to see individuals challenging this. You're going to see states challenging it. You're seeing seniors already up in arms about the cuts to the Medicare program. I think there are huge problems with this legislation, and I don't even think we've seen all of the court suits yet. Dr. Don Berwick is an interesting nominee for the Centers for Medicare and Medicaid Services. He has been widely quoted, including recently in the New York Times, as saying that he's in love with the National Health Service in Great Britain. He believes that that's not only a treasure for Great Britain, but it's a treasure for the planet. And he's basically saying that he's in love with socialized medicine because it is the most socialized of the healthcare systems in the developed countries. And so this is the person that President Obama has selected to run the Medicare and Medicaid programs in this country, which not only already spend about $700 billion a year, but that will have tremendous authority in implementing the Obamacare legislation. So basically he's chosen a rationer-in-chief in order to be able to put the infrastructure of Obamacare in place in this country. I think he's going to be the poster person for everything that goes wrong with Obamacare, because people are going to point to him and they're saying, you love government-run health care, that's now what you're in charge of, look what this has done.